Hi and welcome. I'm trying to learn medicine. Today, Amblyopia, and after that, Amnesia, and after that, medium plane training. And if you participate in medium plane training, that is at your own risk. We're talking about internal anatomy, internal eye anatomy, and diseases. And this is no medical advice, we're just reading about it. So, amblyopia, we did it in the previous part. Amblyopia, that is one type of reduction in the sharpness of vision. In most cases, it is not caused by any disease of the eye, but is either hereditary or the result of an uncorrected squint in childhood. Amblyopia. I don't know how it's pronounced, but I think I stay with amblyopia. Amblyopia. Okay, we want to say something like amblyopia is reduction of sharpness in one eye. It is most of the times not caused by disease, but it is hereditary. In most cases, it is not caused by any disease of the eye, but is either hereditary or the result of an uncorrected squint in childhood. It is in most cases hereditary or the result of a squint during childhood, which was not corrected. Of an uncorrected squint in childhood. In some cases, however, it is due to damage to the optic nerve that has been caused by excessive use of alcohol or tobacco, poor diet, or certain drugs. Treating the cause sometimes improves the vision. Okay, amblyopia, that is reduction in sharpness in the vision of one eye. Reduction in the sharpness of vision. Reduction in the sharpness of vision. It is most of the times not caused through a disease but hereditary, or the cause through the result of an uncorrected squint, or through an uncorrected squint during childhood. It can also be due to damage, excessive. We're using excessive. Let's try to use the word excessive as well. Through excessive intake of alcohol, tobacco, or also through poor diet or certain drugs. If the cause is treated, it helps in some cases to improve the situation. Amblyopia. I'm going to start the camera and try to say that. Amblyopia is a reduction of sharpness in the eye. It is most of the times not through a disease, but hereditary or the result of an uncorrected squint during childhood. It can be also through an excessive intake of alcohol, tobacco, or poor diet. I personally just want to know what the fourth thing is. It's not really important, but what was the fourth thing? Certain drugs. Amblyopia. Amblyopia is the reduction of sharpness in the eye. It is most of the times not through disease, but hereditary or caused through an uncorrected squint during childhood. It can be also through excessive tobacco or alcohol intake, or through poor diet, or caused through certain drugs. If the underlying cause is treated, that can help to improve the situation. And that is according to Keith Hodgkin's Family Medical Advisor book, page 71, but this is no medical advice. I'm going to stop the camera, and when I remember, we're going to do amnesia. Amnesia. Loss of memory, either partial or total, that is so pronounced as to cause worry or problems for the sufferer. Es ist sie not right, amnesia. Now I'm thinking about it. There's some. Maybe I should just read on it, but maybe I should say it because we're also a bit speculating. There's some people who are losing over time slowly their memory. Would that then be in a clinical case called amnesia? Let's read on and maybe find it out. So amnesia is loss of memory that is either partial or total, that is so pronounced as to cause worry or problems for the sufferer. So I mean not just forget one fact, but forget a lot of things basically. It can be caused by a head injury and indicates the presence of concussion. See first aid. Okay, concussion, that is some problem after head injuries. I don't know exactly. I don't really know what the word concussion means. It's some problem which people can get at their head through a head injury. By the patient's emotional states such as hysteria. Maybe we shouldn't read first what's hysteria. Let's take one look what hysteria is. Hypertension, hypnosis, hypothermia, hysteria, hysterectomy. Hysteria, a condition in which the sufferer displays unusual behavior in order to attract attention or to avoid an unpleasant situation. It is brought on by stress in an immature person who is extremely vulnerable to suggestion. It is more common in women than men and may recur. Again, this book's from the 80s, maybe something more known. The term is also used to describe a situation in which members of a group exhibit a similar symptom for which no cause can be found. The symptoms are produced unconsciously, and the motives, although obvious to others, are not faced by the patient. I don't understand it. Almost any symptom can be caused by hysteria, ranging from pain to loss of sensation and loss of use of any part of the body. The response of a sufferer can range from great concern to sublime indifference to the symptom. Acute reactions can result in total loss of control over the emotions and loss of memory. Causes not known. The sufferer, unlike the deliberate malingerer, is unaware that his or her symptoms are not due to physical illness. Resolve a conflict or cause of the anxiety. Use firm reassurance with minimal fuss. Symptoms may be aggravated by both too much or too little sympathy. When you consult the doctor, on the appearance of any symptom that cannot be explained, as the doctor may discover a physical basis for the trouble. I don't really understand it, but I think that's not a bit out of the ordinary. It's some time of emotional unstableness. Okay, now what did we have here? Amnesia, loss of memory, that can be caused through a head injury and indicates the presence of concussion. See first aid. Or by the patient's emotional states such as hysteria. Or by a number of illnesses including alcoholism, meningitis, syphilis, brain tumor and epilepsy. In retrograde amnesia, the victim loses his or her memory for events that happened before some injury or emotional shock. In anterograde amnesia, the loss of memory is for events that happened afterwards. So we're having a retrograde, that is events that happened before injury or emotional shock, and anterograde, events afterwards. In many cases of amnesia, the patient's memory returns with the passing of time or with the clearing up of the underlying condition. But if the cause is emotional disturbance, this could mean that the mind subconsciously wishes to erase some occurrence that is too distressing to contemplate, and psychiatric help is needed. I think I know what we're indicating, but I want to know a bit more about it actually. But that is not part of medicine, I think. That would be part of criminology. Now, that was the medicine part. We don't have time left to talk about it again. Amnesia, we're going to return to amnesia in the next part, where you remember. Now, that was medicine. If you were here for medicine, you can go directly to the next part of medicine. And then we will do probably amnesia. If you stay here and participate in the leg injury prevention training, then is that at your own risk. We're doing medium leg training. We're bringing one leg up. If you participate in the other, one leg up, pull the leg up, point with the toes down, and relax the leg. And the other leg. Pull the leg up, point the foot down, and try to relax the leg. And the next exercise. Now we're having the leg standing around, hip width apart. We're going down a bit down. And now relax the muscles of the upper legs. And now straighten one leg. Completely straighten it completely. Keep a flexing, keep a contraction. And bend it again. Bring it down again. And keep a flexing. And straighten the other one. Flex both legs. and back flexion. In the middle, and come up. And also similar, a bit wider apart, a bit down again. Flex again, relax, pull, press your heel together, and go over to one side a bit, straighten one leg, keep pulling them together, flex or contract the muscles, and over to the other side, straighten the other leg, pull them together the whole time, and contract the muscles, and in the middle, and up again. For complete this also push a bit to the outside. Okay, next exercise. One leg up and press from the top against the knee. Right angle of the leg, flex foot, even line tips, taller with the back, little bend in the elbow. Then you can do it with a lot of pressure or a bit easier. Now, with the other leg. And again the first leg up, and now press from the inside. Right angle of the leg, flex foot, even line tips, taller with the back, little bend in the elbow. And again on the other side. And to the next exercise. Leg again up, and now press with the knee up and to the side. You can do it also again with a bit more force. And with the other leg up, it's up and to the side. And the last exercise, the heavy swing though. One leg again up, press from the outside and down slowly. And crossing. And another time. Keep pressing one more time. And cross again. And the other leg up. Press on the outside and out slowly. And cross again. Open again. And cross again. Bend the leg again up and pull the leg up on the foot down. Relax the leg. Other side, pull the leg up on the foot down. Take the leg at the ankle. Make a straight back, point the knee down to the ground. The other leg. Make a straight back, point the knee down to the ground. Next one out, breathe in, cut out. And breathe out. Again. And out. Breathe in and close the legs. And breathe again out. That was a medium plan training. I thank you very much. Next time.